everybody.
Good morning.
All right, my name is Dr. Sheilandice Brown. I am the dentist at Central Virginia Health Services, Inc., Petersburg. Has anybody here ever heard of that place?
No.
No? Okay, well, we are a community health center right in Petersburg by the DMV in Petersburg off of Wagner Road. And we provide primary medical and dental services. We also have a pharmacy, and we have nutrition counseling and things like that at our community service building. People that come see us, some people have insurance, and also the benefit of coming to our health center is that people don't have to have insurance that come there. So we're kind of like a safety net for the community. We help people that don't always have the means to pay for their medical and dental care. So that's what we do at our facility. So the reason that I'm here today to talk to you guys is because February is what? Does anybody know? Exactly. Yep. February is Black History Month. So that's something to be proud of. And also, February is National Children's Dental Health Month. So I'm here to talk to y'all today about dentistry. So my presentation is Healthy Mouth, Healthy Body. Also with me today are some of my co-workers and my two dental assistants, Shiana and Tiaja. They're gonna wave at y'all.
Hello.
Yes. And then my other co-workers, can y'all raise your hands?
Hello.
Okay. All right. Does anybody have anything to say or any questions first before I get started? Anything y'all want to know? So I can make sure I address it.
You got his
Anything?
hand up.
I see back there. You.
How long have I been doing this?
How long have we as a company been providing this type of care? Do you know, Freddie? What's that?
53.
53 years. Okay, yes. So this company then has been providing health services for 53 years throughout the state of Virginia. I believe it's, what, about 15 to 20 sites?
21.
21 sites. Freddie knows a lot. He works for the corporate office. So, yes, 21 sites around Virginia, around Central Virginia. I have been a dentist for 20 years personally, and I've been at my particular location for about 15, going on 16 years at my particular site. So I'm going to get started. Okay. Okay. So pretty much your oral health is linked to your overall health. Has anybody ever heard of a surgeon general? They're a person that's pretty much in charge of everything that has to do with health, and they're typically appointed to their job by the President of the United States. They kind of set the pace and set the tone for what's important to us as a country, all things health. And so we've had a couple of surgeon generals that deemed that oral health is important. We've had, does anybody know what these guys' names are? Two of our previous surgeon generals.
Dr. David Satcher.
Exactly. Look, give this boy a prize. He is good. Yeah, I think he should get a prize for that.
I get a prize?
Absolutely. Dr. Satcher, and who else? Is anybody else? What's the next one?
Dr. Jerome Adams.
Exactly. Dr. Jerome Adams.
That's the way to get it.
But listen, let me tell y'all something. The good part about what these guys are doing is that they are reading the paper and they're paying attention. So I think that's commendable. So Dr. David Satcher and Dr. Jerome Adams were the 16th and 20th Surgeon Generals of the United States. And they also are two of our former Surgeon Generals that addressed oral health in their report. And I also just wanted to make sure I mentioned that to y'all, just to let you know that that's something you can aspire to. All right. So again, the mouth is often referred to as a window into the body and can give insight into various conditions that's going on the rest of your body, like diabetes, pregnancy, heart disease, nutritional and vitamin deficiencies, respiratory ailments, and cancer. Other things that contribute to what's going on in the rest of your body, having proper oral hygiene, your diet, medications that you're on, tobacco use, all these things play a vital role in affecting your oral health and your overall health. So it's important to have proper oral hygiene. What do y'all think that includes?
Like good teeth, like
Healthy teeth.
breath smell good.
That's right.
Yeah.
All right. Hearing a lot of good things. Yup. I know what to do when they say real good stuff like that. Okay. So you got to maintain healthy teeth and gums. I think somebody said that. How you gonna accomplish maintaining healthy teeth and gums?
She had her hand up.
Come on. What are you gonna do? What's that? That's right. Anybody else? Right. Yep. Y'all gotta be paying attention. These guys are saying some good stuff. How many times a day should you brush? Twice a day. Absolutely.
So everybody get right.
And what does the toothpaste that you use contain?
Fluoride.
Absolutely. Y'all
dental,
already know this stuff.
Yeah, I do.
Okay.
Yeah, snacks.
All right, this is a tricky one. How many times a day should you floss? What's that? At least once.
Once, I said once.
All right.
I said once.
This young man in the front said once.
Right over there.
So if these guys can brush
bro.
their teeth, I know you can too, right? Does everybody in here though brush at least once a day? Raise your hand if you brush once a day, at least.
I brush teeth.
Does anybody in here brush twice a day? Wow, all right. How about the flossing? Does everybody floss? That's a little bit harder. All right. All right, so I'm moving on. It's also important to have a good diet. It's hard to tell people to do this, but of course we want you to eat more nutritious foods. Can y'all hear me? Okay. Eat more nutritious foods. Does anybody know what the danger is of drinking mostly bottled water? And I do have a hint on here. Well water, if you have well water, which I did when I was coming up, but well water has the same danger if you drink, oh wow, I did that. Okay, well water has the same danger if you drink bottled water all the time. What do you think it might be? Nope.
Filter.
That's a good idea, but nope. Y'all give up? You want me to give you the answer?
Could you give us another hint?
Right here. Does anybody know the danger of drinking bottled water all the time? And we do it all the time. We get a bottle of water, go right to the store, buy the bottle of water.
Drinking bottled water.
All right, I'm gonna give you the answer. The answer is because most of the time bottled water does not have fluoride in it. City water is mandated to put fluoride in it. And that's what helps you remineralize your teeth. So it's very important to really try to drink the tap water.
Oh, my brother was saying something about that.
Yeah, it's
I don't like it.
important.
It's still nasty.
All right, also consider your medications. A lot of times people are on medications for various reasons, and you need to be on medications because that's helping keep you healthy or helping take care of any kind of condition that you have. But many medications, including vitamins, a lot of people take vitamins, natural minerals, and herbal preparations can have a negative effect on your oral health. So let's discuss some of those things. Does anybody take things for bleeding issues, or does anybody have any bleeding issues, or know somebody that does? A lot of people live with their grandparents or have older parents. They could be taking some things for bleeding disorders, or they might have had a stroke before. Somebody had a stroke before, or some kind of blood clot issues, and a lot of times they're on medications that can cause bleeding.
Like blood thinner.
Right, blood thinners, exactly. I think you should get a prize. Of course, blood thinners, exactly right. And then you need to know that because suppose you need a tooth out. That can affect that. But guess what? What else is a blood thinner that you may not be aware of? Anybody take that for a headache? Anybody ever took that before? I know, right? That's what? Full of aspirin. And your
Shit, at the BC,
Advil.
that's what you be saying.
Advil and those kind of things, those things affect your platelets in your blood, and the platelets is what causes blood clots. So you taking Advil today because you got a headache, then you go get a tooth pulled, it may not stop bleeding. Okay, other medications can have like a bitter or metallic taste. These are the types of things, types of medications that can cause that. Some medications can cause sores. So many people get cold sores. I ain't gonna ask y'all to raise your hand because that's kind of embarrassing. But a lot of times you get cold sores. You know how sometimes you get a little cold sore on your lip and stuff like that. And it might come on there, be there for 2 weeks, then go away. You try to put ointment and stuff on it. Oh man, enlarged gum tissue. Some people have seizures, and they gotta take a medication, yes? It is, but it's not the type of herpes like you're thinking. It's different types of herpes, right? Herpes 1, above the waist. Herpes 2, the kind you don't want. So, herpes 1, yep, cold sore type. But here's the thing, now you know, so you're like super smart now. You were exactly right, but it's 2 different types of herpes, right? He was asking me about herpes, isn't the cold sore a type of herpes? And I'm like, yeah, it is, but it's not the type of herpes that you might think. But probably it could be. So anyway, moving on. Enlarged gum tissue. If anybody knows somebody that has seizures, the types of medications that they have to take every day to prevent them from having a seizure definitely causes the gum tissue to get real bulky. Once the gum tissue gets like this, it's hard to keep those areas clean. Then we end up getting a lot of bleeding, a lot of tartar to build up there. Also, people who have had organ transplants, they get put on special medications. Same thing causes that. Does anybody know of another word for enlarged gums? Come on, somebody who hasn't said anything the whole time. Oh my God, that is exactly right. Oh my God, he needs a prize. He said hyperplasia. That is so crazy. I didn't even know that. He needs to get a prize. Okay, and then dry mouth. Dry mouth, if you have dry mouth, don't be embarrassed. It could be the medications that you take. One medication by itself might be fine, but then if the doctor puts you on another one, when the 2 of them combine, a lot of times they cause dry mouth. And then this big word right here, who knows how to, oh, I did that. Who knows how to pronounce this one?
What?
This word right here.
Antihistamine.
Close. Real close.
Antihistamines.
Yeah, that's right. Antihistamines. So, all right. Oh, wait. All right. This really seriously. This serious for a good prize. Get a good one. What is an example of an antihistamine?
A person with a dry mouth?
No. I mean a type. An antihistamine is a type of medication.
A painkiller.
Nope. Right. I'm gonna give you the answer. A type of antihistamine that a lot of people take is Benadryl.
Oh yeah.
So like people take Benadryl often, right? So this causes dry mouth. Decongestants, these are the cold medicines. Painkillers. I almost get an answer. What is HBP meds?
Y'all just said it.
Yes. You said that. I didn't hear you the whole time. She need a prize.
I got some
High blood
snacks.
pressure medicines.
I got some